Hello, I'm Dr. Steve Karstensen, Editor-in-Chief of Dental Sleep Practice Magazine, a mid-mark publication. Welcome to a live presentation and Q&A with Iain Spray of BluePro and Dr. Kent Smith with Sleep Dallas, 21st Century Dental and Sleep Center. Today, we'll be discussing the prefabricated thermoplastic mandibular repositioning device, BluePro. It's been newly cleared by FDA for same-day treatment of snoring and mild to moderate OSA. In studies, it has demonstrated good retention, efficacy, tolerability, and satisfaction, a level of clinical success over 6 months comparable to third-generation custom devices. In this webinar, we'll review the features of this appliance, demonstrate the fitting process, examine the key evidence, discuss real-world clinical experience, and consider the role of BluePro in U.S. clinical practice. Before we get started, I would like to invite viewers to use the question bar in your control panel to ask any questions. Your questions will be answered at the end of this presentation. So I'm pleased to introduce our guests for today, Iain Spray and Dr. Kent Smith. Iain Spray is a medtech marketing consultant who has worked with BluePro since 2014 to develop new markets for BluePro. With a background in medical communications, research publication, and product development, he practices evidence-based marketing and brings a subject matter strength in sleep disorder breathing. Dr. Kent Smith is president of the American Sleep and Breathing Academy, diplomate of the American Board of Dental Sleep Medicine, and is on the advisory committee of the Australasian Academy of Dental Sleep Medicine. In 2007, he was asked to start a sleep curriculum at the Las Vegas Institute of Advanced Clinical Studies. In 2011, he started the School Kids in Safe Hands initiative to keep bus drivers and students safe on the roads in his home area of Dallas. In 2012, he was the first in Texas to be awarded a dental sleep medicine facility accreditation and is the creator of the Best Sleep Hygiene app, which is a free download. That same year, he was asked to host a radio show on sleep disorders and has been the host of Pillow Talk for the last 3 years, every week on KAAM 770 in the Dallas area. Kent Smith is well known in our industry, and to have him on this webinar talking about how to use this innovative product is a real plus for this webinar. So I'm looking forward to hearing what both of these guys have to say.
Thank you very much, Steve. So I'll start by giving a little disclaimer, which is that I'm a British marketing guy, not a sleep dentist. So everything I've learned about sleep dentistry has been with BluePro in the last 3 years since we launched BluePro in Europe. And that means many of your viewers will be more expert than me. But what I can offer today is an evidence-based presentation, which means a demonstration of the features of the product through an actual fitting demo, as well as a review of the published evidence that support the product claims for this device. And let me start by explaining the background to this product, because it was invented by clinicians working with sleep disorder breathing patients in France. And they wanted a device that was going to be professional quality, which means adjustable, retentive, and durable, that could last up to a year in therapy, but that also would be quick to fit, same day, and also low cost and affordable. Because we have this issue in Europe where reimbursement is quite patchy, and sometimes where there is reimbursement, it's at quite a low level and sometimes not enough to cover really good custom devices. So in practice, in Europe, this is used as a trial or transitional appliance in between therapy with a custom device. But actually more often it's used as a pragmatic therapy device, especially in settings where the patient's paying themselves. And as we'll see in the evidence later, this can be used as effectively as custom devices over 6 months and probably up to a year. So let me start by giving you a quick demonstration of the fitting process. and some of the features of this appliance. This is the kind of kit that you'll need to make the appliance, which is not very complicated. A dish for some boiling water. A scalpel is useful, and I've got a number 21 blade on here, which allows you to make some of the cuts that are useful in this device. And as you may have heard in the background there, a fast boil kettle is also quite useful to have in the office, and it may not be something you have normally lying around. But this is the kit that you get when you buy the device. There's a hard carry case there for the patient to take it away. There is a soft cloth bag there also for storage and transportation. There are some instructions for use for the patient, and of course the device itself. Now it should be noted that this is a prescription-only device, so it's a boil and bite, but it's a professional boil and bite, and should be fitted by a professional after a diagnostic assessment by a physician. To show you the two splints here, obviously these are prefabricated, and as you can see, these are they have a plastic, real sand plastic outer tray that is pre-filled with thermoplastic. So at the moment this is rigid, but when you immerse this in boiling water, this is going to become very malleable. You can adapt it to the shape of the arch. So let me start by immersing the splints in boiling water. And this works best if the water is just boiled, just from the kettle after boiling, and you will see that this goes soft probably within a minute. I should mention here some of the criteria for patient selection, because of course this is a prefabricated device. It's not going to fit every patient. You know, when the device is assembled, it's a monoblock, and you know, you're asking the patient really to be able to bite into a device that is aligned here along a very flat plane. There is no mouth opening with this device. So if the patient has very irregular occlusion, I mean a large open bite or a high curve of SPE or a cross bite in particular, it's going to be difficult to get into this device, then you shouldn't attempt to fit this device actually on those patients. You know, this is the key limitation really. Very irregular occlusion should be avoided. But the sizes of the arches actually are much less of an issue because the splints will flex to fit most arch sizes. Otherwise, the contraindications are the same as for any oral appliance. You know, no gum disease, no TMJ problems, no loose teeth. If you find that there's something that's a little bit unstable in the mouth, like a temporary crown, then you can protect that tooth with a little bit of Vaseline. That helps the thermoplastic not to stick to that tooth. If you have something like an undercut or something where the thermoplastic could go under, you could also block that out with some wax. But in general, I think as you can see here, the splints don't go over the whole tooth, rarely. I mean, so, you know, there's never been a reported case of something sticking under an undercut and not coming off. But just be careful of obviously something that might be loose. We once had some training where a dentist forgot he was wearing a permanent retainer in the back of his upper arch, and that was, of course, pulled out by the device. It's not a mistake you're likely to make, but you can understand those kind of limitations and considerations. So this is the splint after it's been heated, and you can see it's gone completely clear, the thermoplastic, and you can see right through to the tray beneath. So you know it's ready to come out, and it can be flexed quite wide or quite narrow to fit the shape of the arch. So we're taking these out of the boiling water for no more than a minute actually before putting these on the teeth. And when you come to fit this, you're looking for the alignment of the midline on the splint with the dental midline, and just take a little bit of time to position to make sure it's covering all the teeth, and then just push on. And as you push on, this is designed to allow the thermoplastic in the back, in the lingual side, to splurge out a little bit, and then you smooth it around with your fingers. So this makes the device actually very retentive, and the smoothing makes it, has a nice smooth finish for the tongue, increases the space for the tongue. Similarly with the lower, you are lining up the midline. Can be a little bit more tricky because of these wings that are loose, hanging at the side, and you have to get these inside the mouth really before you push on. And as you push this on, you may also find, because of the cheek inside is pushing against this, you might need to hold it in place. But as it cools, it also expands very slightly. So if it doesn't grip immediately, it will grip quite quickly, especially when you reach inside like this and you smooth the excess with a finger. Patient can at this point bite together, and this might also help to even out any irregularities in the occlusion. But basically they can relax for 4 minutes. This is the rule, 4 minutes on the teeth. And here's one I made earlier to save us waiting that time. When it's ready to come off, you're looking to reach inside with your finger along this rail and pull off from the back, and you'll find that it pops off. And then you can see you have this very accurate impression in the device. And the tray is designed really here to push the material, the thermoplastic material, into all the interdental spaces, which really makes it very retentive, and sometimes too much so, actually, and this might cause some discomfort because it's too tight, too much pressure on a tooth. You can alleviate this by trimming with a knife in here. So you can see there is some material in the interdental space, and by just cutting some slivers out here with a sharp knife, you can really alleviate the pressure on that tooth. But you're waiting really to be led by the patient on this. Once it goes back in the mouth, you can check how it feels, and if you need to make a cut, then you can do it. Otherwise, the only cut you really need to make here is on this back edge, because you can see that there is a scale on the underside of the splint that you want to read from the other side, and the other splint is the same. So you really want to cut that back edge so you can read the splints properly, and a sharp knife makes it very easy to cut this back edge. So you can read that scale properly. So you can immediately put this back in the mouth by assembling, and this rail on the edge just slides into the lock, and you can hear those clicks as it goes in. Each click is a millimeter, so this has millimetric titration. It titrates independently on each side, and you want to start by putting this in a very neutral position so the patient can easily bite into it. And you can put this unlocked back in the mouth, upper first, and then they can bite in with the lower. And you can often hear that snap as it goes in. And the patient can move their jaw now because it's unlocked. So you can bring them forward to a comfortable starting position. You keep an eye on the midlines to make sure that one side isn't going forward more than the other, and start them at a point where they're comfortable, but you think they may get some symptomatic relief. This is guesswork, but quite often, just by setting them in that kind of position, either at 50%, you are giving them symptomatic relief on the first night. So when it's comfortable, you remove from the mouth and lock in place. You can see that there are some blue buttons on the side here, blue locks, and you apply some pressure here to lock, and then it doesn't move. So this is then ready to wear for the patient, and putting it back in the mouth at this point is probably a good idea, just to check that it's still comfortable after locking, and also to check, is there any pressure somewhere in the mouth, somewhere on the tooth? Is it uncomfortable somewhere? Do you need to make a cut somewhere? Is it coming up the gingival somewhere that might be uncomfortable? Again, you can just cut that thermoplastic with a sharp knife to make sure that doesn't cause any problems. And then otherwise, you know, you can give it to the patient to take away. It's very important actually that they are instructed to clean this, because this will be the biggest limitation on the life of the device. You know, we've been recommending in Europe this product called Nitrodene Ortho, which we know kills the biofilms without degrading the plastic in the device. And we're not sure yet which is the best kind of sterilizing solution in the US market, but something like that, you know, soaking for 15-20 minutes 2 or 3 times a week will really prolong the life of the device. Otherwise, that kind of discoloration and smell and unhygienic condition that they will eventually find themselves in is going to be the limiting factor. Otherwise, as you can see, this is a monoblock, no mouth opening, which has, you know, benefits and sometimes can be a problem. Obviously, if you can get a lip seal and keep your mouth closed, then that's quite nice for you know, you're not drying out the airways, you're not drying out the mouth. Drying out the airways can cause inflammation as well, as you know. Breathing through the nose is always a lot healthier if possible. If the nose is obstructed, you can still breathe through the space in here, and there is a spacer in between the splints to make sure that space is preserved. But ideally, the patient would be breathing through the nose with this device. So let me move now from this. Obviously, you're giving the patient their device. They can take it home in the box. You're giving them the instructions on how to care for it. Also, I should say, you're giving them an instruction on how to adjust, because by opening these locks, sometimes you might need a tool to do this at one side then the other, you can adjust it, and the patient can self-adjust it. So they can bring themselves forward. Or if you don't want them to do it, you don't tell them about this feature. But either way, it's not difficult to unlock and then move forward, and each click is a millimeter. And then obviously you lock again by pushing in these buttons. So I think that's everything for the actual manufacture of this device. Let me move now to show you some slides with the product evidence. So the first study on this product was conducted, hang on a second. The first study on this product was conducted by Professor Brem, who's the president of the European Academy of Dental Sleep Medicine in Antwerp. And he has a lab where he's developed these jaw models that can test retention of devices. So the devices are fitted to the models, and they pull apart, and they measure the force in newtons that's required to pull out of the device. And he also, in the study, examined the quality of the impression and the durability of the material in that testing process. And what he found was that at 2 different settings of protrusion, 3 millimeters and 8 millimeters, the forces of retention in this device were preserved at around 26 newtons from the 10th cycle, which means the 10th time pulling off the machine, all the way through to nearly the 700th cycle of coming on and off the machine. There really wasn't any deterioration in the materials or the force of retention at 26 newtons. So this was an early study which kind of validated that the device can stay in the mouth at night, even though this was a mechanical study. But then this was followed this year actually by there was some other clinical evidence in the meantime, but this study really was the best test so far of the efficacy, clinical efficacy of the device. And this was published in August in Respiratory Medicine. And this was a comparative study in 158 patients, an independent study, completely free of any influence from BlueSum. We gave them some free devices, but otherwise we had no involvement in the conduct of the study. And they had two different groups of patients, one wearing BluePro and one wearing custom-made devices. All of these patients were sleep apnea patients. And after 6 months, they found that the treatment response was actually better in the BluePro group. More patients had complete response, fewer patients had treatment failure in the BluePro group. But this actually wasn't, it's not fair in this kind of study. It's an observational study. It's not fair to compare two groups directly, because the groups didn't cross over. You know, they didn't wear both appliances in the same patient. The patient groups had different characteristics, and the BluePro group was actually younger, lower BMI, lower severity of OSA. So not a fair comparison, actually, but you can adjust for these things in the statistical analysis. So when they did that stats analysis, actually they found that there wasn't any statistically significant difference between the two device groups in terms of all of these primary outcome measures of sleep disorder breathing symptom relief. So you can see in this box and whisker plot all of these whiskers, these arms that go off to either side of the value. When they cross zero, essentially that means that there's no statistically significant difference. So this was an important finding, actually, to say that a thermoplastic device like this can treat those symptoms, those key outcomes, as well as a custom device. They also found in asking those patients about satisfaction and compliance that the satisfaction rate between the groups was very, very similar on a visual analog scale. Between 0 and 10, almost no difference. Compliance was measured by questionnaire, actually, so and sleep diary. So actually this is not as good a measure of compliance as a compliance chip, for example, but still no statistically significant difference between the groups in those two measures. And also in side effects, you know, patients were asked to rate this on a scale of 0 to 3, where 0 was absent and 3 was severe. And actually, in fact, two of the side effects measured here the difference was statistically significant. So there was more tooth pain in the BluePro group and more self-reported occlusal change. And I think that's really a fair reflection of our real-world experience with this device. You know, the thermoplastic does go tightly around the teeth, and it can feel tight. Of course, you know, I would put this into context by saying that the pressure can be alleviated by cutting out some of that interdental material, as I showed you. But also this absolute value here, 1.3 for tooth pain out of 3, is still closer to mild, actually, than it is to moderate. So it's not a severe problem, really. And indeed, when they kind of rolled together all of those side effect scores into one global score, they found there was no statistically significant difference in that side effect profile between the groups, just about. So, you know, from this we were kind of vindicated in these product claims that we're going to make for, especially for the US market, where we want to promote this device as a prefabricated product which can perhaps perform as well as custom devices over a shorter term, 6 months to a year, in dentally suitable patients. And we always have to add that caveat. You know, it's not going to fit every patient, and the occlusion is particularly important. But these are the roles that we understand that the device will play in US therapy, particularly as a transition appliance, something to give the patients on the first day, also as a trial appliance to identify responders. And there's some research going on with Dr. Andrew Wellman's group in Boston using BluePro to identify responders there. Also as a complementary device, so as a backup or a temporary respite from CPAP, and maybe as a pragmatic therapy, as it's used in Europe for patients without access to custom devices. You know, where patients are paying, and it could be without insurance or for snoring. But I'd be interested to see what you guys think about that role in particular. Excuse me. Before I leave this slide, actually, I just wanted to add one commercial slide here, which is about the offer that we have for first-time US customers. And this also speaks to the price of the device. You know, if you buy a 3-pack of BluePro for $330, we're offering an extra appliance free of charge for practice, and a display model as well, so you can show this to patients. And if you're interested in that, you can contact us at hello@bluepro.pro. But with that, I'm going to hand back to you guys, and we can have a conversation about the possible roles in therapy, and especially how this product is used in Dr. Smith's practice, which is obviously one of the leading practices in the country, and they have some experience now with this product.
Kit, we would like to hear about your experiences. What can you tell us about your how it's working for you in your office these days?
Well, Steve, thank you for having me, first of all. I will say that we've used temporary devices. I'm just going to, for better sake of terminology here, we'll just call this a temporary device, even though it can be used for other. But we've been using temporary devices for many years, and we've never been thoroughly pleased with any of them. And so now that we've found the BluePro, my team, I've got 4 sleep assistants, full-time sleep assistants, and to a man, they love this one more than any other. So they're much more likely to suggest the use of the BluePro than they have other devices. And as Iain mentioned, we use it in many different scenarios. By far the most common reason for us to use it these days is when we're waiting on medical insurance to okay a custom device to be made. And that interim has gotten longer over the years. And as for some reason in the year 2017, it's even taking us longer to get approval. So that gets a little frustrating for patients. And to alleviate some of those concerns and the angst, we make them a BluePro, and we do this typically at the initial consult appointment. Sometimes we wait a week or so, depending on scenarios where we're getting authorizations for the EO485 code. So I don't know if you want me to go into that yet, but at least that's how we use it primarily in our office. We also use it if somebody's going to be having some dental work done soon, but they want to have something done. And retrofitting a custom device can be problematic. So in that situation, we will make them a BluePro. Visitors from out of town that forgot their appliance, they'll come in and want something fast, and that's another time that we might want to use a BluePro. They can't afford a custom device, or they're snorers and want to minimize their cost. There's various reasons that we'll use the temporary device like this, but we found, in fact, I just went back the last couple of days. 2 days ago, we delivered 6 of these, and yesterday we delivered 2, and I think we're scheduled to deliver 2 today. So we're definitely using them in our office.
How long has the longest one been that you've been using? So what are you seeing over time?
Yeah, it's only been about 3 or 4 months since we started using them, so I don't have any long-term stories for you. As far as I know, we haven't had this smelly. I know at some point you're going to get that. It's going to become gross. But
it is a temporary appliance. So Iain, how long is do you know somebody in France or Europe has used these? I know you put them out as affordable solution when somebody can't use a full custom device. So that implies a pretty long-term use.
Yes, and there are regularly patients getting a year's use out of this, but they have to look after it. They have to soak it. And if they don't soak it and they don't keep it clean, I mean, you can also clean it in the morning with cold water and toothpaste, and that's very helpful. Of course, we would recommend that as well in the instructions that we use. But yes, I mean, if it's not cleaned and it's worn regularly, and there's a high kind of bacterial load in the mouth, then it can go gross after 30 days even. So you have to balance this, and you have to sort of kind of tell the patient you have to do this.
It's like every other device. Nothing's universal about that. It's all up to the patient to take care of things, and we can coach them on those things. Yeah, good. So I do have a question about the fitting in the teeth. As you've done this, have you found any troubles with people with the real irregular occlusion, like Iain was talking about, or missing teeth, or if they have, how many teeth do they have to have? I guess is what one of the questions that I know I get asked when I lecture. So what about you?
Sure, yeah. Well, I thought it interesting when Iain was talking about it doesn't fit everybody's mouth, because we've not had one yet that it doesn't fit. Now, we've only done about 50, but up to this point, we haven't found one mouth that it hasn't worked on. We haven't, that I know of, tried it on anyone with 6 teeth or anything like that. So I don't really have a number of teeth that I could tell you that it won't work on, but I would tend to think it's the same as a custom device. We like 3 teeth in each quadrant, and it's depending on where those teeth are, obviously.
Sure. I do have a question about the fit also, because something I saw in the model was that it doesn't cover the second, or the terminal molar, it seemed, on that model.
Yes.
And, that is a big feature that a lot of dentists ask about their custom devices. That, do I have to capture the last tooth, and do I have to wrap around the last tooth, and are teeth going to move? And can you address that with a fit of these, given that we're thinking about, a fairly long term sometimes for these patients?
Yes. Yeah, and you can see, hopefully in this model, that sometimes if you don't cut this excess thermoplastic at the back edge, sometimes it is covering all the way to the back there. But yes, in general, this is a consideration, and it's not designed for long-term use. So you do have to watch out for that, and accept that that's going to be possibly an issue.
Yeah, Steve, as it's a transitional model, we've taken an impression for the custom device at that appointment. So if we get any drifting or opening up of spaces mesial to the second molars on the lower, then those will close again once the custom device is in place.
Oh, good. Then nothing to worry about there then.
Yeah.
So, say more, Ken, about how you've approached your patients with this in terms of as an offer, because they've come in to see you for airway issues, and now you're going to be offering a custom device. Sure, that's maybe what they heard about you about, but now you've got something new. How does that impact your patient communication there in practice?
Yeah, we don't mention it on the phone. We don't say you'll be coming in getting a temporary device, but when they're in the office, first of all, we've run their benefits, as everyone is supposed to do before somebody comes in, if you can. And if we've done that, we always ask for the EO485 and the EO486 codes. So we know ahead of time if that's a covered benefit. And right now we're finding with Blue Cross, we're finding about 80% of the time it is a covered benefit. With UHC, not so much. Cigna and Aetna don't require pre-auth. So a lot of that's because we've only been doing it 3 or 4 months. There's a lot of things we don't know yet, but we've worked out a system for explaining to the patient that it could take 3 or 4 months before the custom appliance is ready. I mean, honestly, the way insurance companies keep telling us they didn't receive the information, et cetera, everybody knows what happens when you deal with medical insurance here in the States, Iain. Unfortunately, you aren't that familiar with what we have to deal with, but it can be problematic. And so we tell them it's going to be 3 or 4 months possibly before they get their custom device, and would they like a temporary device to last them until that time, and then they can use that then for a backup appliance should anything happen to the other one, or they lose it or whatever. So that's how we're handling it, and cost will depend on, you know, benefits that we've gotten from them, if it's approved or not, their situation, a lot of different things. We don't have a set fee. It could be anywhere between $200 and $800, depending on the situation in our office.
But you really build the value for that service in your office as something else they can choose. Yeah.
And then we're not doing it as a sole therapy very often. We may have done that once because a patient couldn't afford the therapy for the custom, or it's getting towards the end of the year here, and maybe they want to wait till next year to use their next year's benefits. So we make a temporary one. If we're not impressing for a custom device at that appointment, we're more likely to charge about $800 for it. And then next year, we may let some of that go towards the cost of the custom appliance next year when they come back, things like that.
Sure. Okay, back to fitting questions for you, because something occurred to me as I was looking at that, is I like a bilateral adjustable device because we can allow for patients midlines or shifts. But Iain, you made a kind of a deal about those markings and aligning them with the patient. As you're fitting this to a patient, can you talk a little bit about how you deal with midlines and also how when people move their jaws and they deviate to one side?
Yeah, that's really nice because you can bring one side a little bit further forward than the other side once they start to protrude forward. So I mean, I love those midline marks. Iain, don't change that. That really helps. Okay, but that has not been a problem at all. If they do tend to deviate when they protrude, now we do let the patients do some adjustments. We haven't had any issues. I think people have good, strong thumbnails and they can pull those out. So we do tell them at the delivery that they're welcome to do that. Of course, it depends on the type of patient. We might not tell everybody that they can do it.
Sure. And one of the pieces of data that came out of the research paper that you presented there, Iain, was the bite changes. Now, you know, we're not going to get into a long discussion about bite changes here, but what do you tell your patients about that, and do you provide like an AM positioner? Because that doesn't come with a kit. So what do you say?
We have various different AM positioners in the office that we make, but yeah, we discuss that side effect at every single appointment we see the patient, and the temporary device is no different. Okay. They could certainly get that, yeah. I kind of get excited when I see a bite change. I think it's a healthy thing, but that's just my own perspective.
Okay, I'm not sure everybody in our profession shares that one, but I can see that a little bit. Okay, one other thing about the technical materials here, Iain. I know in other thermoplastic devices we have to choose from, that after it's fitted and we tell the patient it's going to feel this way, after it finishes cooling, it's actually tighter or changes the fit a little bit. Is that true for your thermoplastic material, and do you warn patients about that?
Yeah, I mean, a step I missed out of that process actually was running this under cold water after you've taken it off the teeth to make sure that it's finished its cooling process, because yes, in theory it could continue tightening slightly after you leave it. So that is an important step, to rinse it, make sure it's completely cool. But yes, sometimes the patient will come back and it feels tighter than when they went away. And again, you can alleviate that a little bit by cutting it, as I said, inside. And it's better to use a sharp knife for that than a burr, for example, because the action of that will heat up the material unless you do it on a slow speed and take the thermoplastic off onto the burr.
Yeah, I know one of the values is to have a patient put it in and go, wow, that's snug, but it's not too tight to use. And so by running it under cold water, they're in the office. It'll be the fit it'll be when they get it out that evening to put it in before they go to sleep, and we'll build proper expectations that way.
Yeah.
Okay. Ken, do you want to say anything more about the flow of this in your office? I mean, do you present it? Does your staff present it? is it, you know, how does it come up really in that conversation? Say a little bit more about that. I heard about the timing of the pre-auth and things like this, but what are some other reasons why you might offer this one that the patients have said to you or your staff?
Well, yeah, I do. I like to delegate, so it's usually the team member that's discussing this with the patient. And I can't tell you how each assistant discusses it with the patient, but the way I perceive it happening and the way I've heard it, and certainly when I've discussed this with patients, we just let them know that it's going to be a while, and this is something that is very comfortable. We can do it fairly quickly. I've asked all my assistants how long it takes from start to finish with this, and they tell me anywhere from 20 to 30 minutes. When I did it, it took me about 10, 12 minutes, but maybe I got lucky. It was just an easy case. I've only done one myself. Everything else has been done by my assistants. Yeah. But when they do it, yeah, when they tell the patient that it's going to be months before the custom one is made, many times that shocks the patient. They don't know that it takes that long. And we try to blame it on medical insurance and things, saying, you know, the custom one will be back, but we might not get the authorization to deliver it for months down the road. So would you like to get a temporary appliance? The way we do this, by the way, I know that a question a lot of dentists have is, how can we get medical reimbursement for this? Well, we have it to this point, build it before EO486 has been paid, okay? We're waiting on EO486 to be paid, and then there's nothing that says you have to bill EO485 on the very day that you deliver it. So we just wait to bill EO485 after we've been paid for EO486, and that's given us better success with that. And if we've done the benefits, if we know if it's been pre-authorized, we know that they're going to pay for it, then we offer it at no charge for the patients. So it's kind of a no-brainer. They'll say, well, sure, I'd love to get something right now while I wait for the custom one.
Well, it sounds like a great way to add value to your service to your patients and get them into treatment faster. I mean, I know there's been other temporary appliances for a number of years available to us, but my experience is just like yours, Kent. I haven't found one yet that I think, wow, this is the only one I ever have to look for. So I'm kind of excited about using this. I just got this one, so I'm not, I don't have your experience, but I am quite excited about this because of some features I like about it, especially the part that everything's contained within the mouth. You know, we don't have anything sticking out of the mouth, and I think that's going to be much more acceptable for patients to use.
Yeah, and one thing we also found with others, you have to have extra material in your office to add to the appliance. And with the BluePro, so far, with all the ones that we've delivered, we've not had to use any extra material, which kind of surprises me.
Oh, yeah? Okay, good. Yeah, yeah, to get the retention just right and make patients comfortable on that.
Right.
Very good. Okay. Well, is there anything else you guys would like to add to our webinar today? For the people listening to this, I think this has been an excellent introduction of what I think was going to be a really great product for us to have available for our patients. So is it, Iain, anything else you'd like to add?
No, that's great for me. Thank you very much for your time, and especially Kent for sharing that experience. It's very helpful for me as well as for the audience, I think, to hear your viewpoint. So thank you. Okay,
so now we'll move on to questions from the audience. So, on behalf of Dental Sleep Practice from MedMark Media, thank you everyone for your questions. We run out of time today. So if we did not get to your questions, we will answer it after this webinar by email. So just send us a note and we'll make sure that Dr. Smith or Iain gets a chance to answer your questions. Thank you again for attending this webinar, and a special thank you for Iain Spray from Bluesom and Dr. Kent Smith from Dallas. Thank you and have a good evening.